Hello students, welcome to the e-learning course in the discipline of community medicine. So these are the learning objectives of this course, that is, at the end of the course, you will be competent to become an Indian medical graduate and you will possess the requisite knowledge, skill, attitudes, values and responsiveness, and you will be able to function appropriately and effectively as a physician of first contact in the community. This is very important. I'll give you a brief overview of the discipline of community medicine. So let us look back into the evolution of community medicine. In the early period, there was a leader of Greek medicine, Asclepius. He had two daughters, Hygeia and Panacea. Hygeia was worshipped as the goddess of health, which represents the present-day preventive medicine. And Panacea was worshipped as the goddess of medicine, which represents the modern curative medicine. And this is the staff of Asclepius, this is a symbol of medicine. Hygiene came from the goddess Hygeia, and this itself is a Greek word, hygeia, which means soundness or wholeness, and it implies maintenance of wholeness of the body and keeping fit. In the modern era, the concept of hygiene came into further focus and several terms came out based on this concept. So the most important ones are public health, preventive medicine and social medicine. Public health implies protection of the health of the public, and this concept came into force with the Great Sanitary Awakening. So in the 18th century, there was industrial revolution, so lots of industries came up and people from the rural areas, they came to the urban areas in search of job and they made temporary settlements around the industries, and that is how the slums grew. And the living conditions were very insanitary, unhygienic and unclean, and these people were constantly falling ill. Different diseases were constantly appearing in them. And so Edwin Chadwick, he was a lawyer in England and he investigated the living conditions of these workers, industrial workers, and he came to understand and he established that filth is a cause of all ill health. And there were a lot of disease outbreaks, cholera outbreaks were occurring very frequently. So then John Snow, he was a British epidemiologist, he investigated and he established that contaminated drinking water was the cause of cholera. Subsequently, public health came into force, the Public Health Act was enacted, and C.E.A. Winslow, he gave a definition of public health, which was adapted by the World Health Organization, and a formal definition of public health was proposed. And this I will discuss in the relevant section later on. Second term was preventive medicine. Subsequently, this came into being. So, preventive medicine means to provide measures for large number of population for promotion of health and prevention of disease. So here James Lind, he did an experiment and he established that intake of fresh fruits, including and especially citrus fruits, prevented scurvy. Then Edward Jenner, he invented the smallpox vaccine. Louis Pasteur proposed the germ theory of disease, and Cox postulates. These again I will discuss in the relevant sessions. And Ronald Ross established, he found out the life cycle of malaria parasite in the female Anopheles mosquito, thus establishing the mode of transmission of vector-borne disease. So all these discoveries and inventions and these theories, they gave rise to the preventive medicine. So this means that there are factors which have been understood which influence health and disease, and if we can prevent those, we can prevent disease. Subsequently, it was realized that not only the physical environment, it is also the social environment that is very important for health of the people. So, social medicine came into being, and that implies maintenance of health of the individual along with the health of the entire community to which the individual belongs. The individual is a part of this community. So, the community and the environment has to be healthy, the society should be healthy, then only can the individual be healthy, and that is targeting the individual or man as a social being in his total environment. There were stalwarts of social medicine, Jules Guérin, Alfred Grosjean and many others. Currently, three terms are in use: public health, family medicine and community medicine, and there are postgraduate diploma and degree in all these disciplines. So, public health focuses on environmental and social determinants of health. Family medicine is responsible for all health problems of a family and responsible for maintaining good health of all the family members. And community medicine, it aims to achieve health promotion and disease prevention in the entire community. So there are similarities as well as subtle differences between these disciplines. So both family medicine and community medicine, they are amalgamation of public health and clinical medicine. But family medicine is more of clinical medicine than public health, while community medicine is more of public health practice along with primary level care of clinical medicine. Community medicine is a very vast discipline. There are several domains that come under the purview of community medicine. So we have our broad allied areas, that is family medicine, public health, epidemiology. Then there are some clinical subspecialties, that is social or community pediatrics, social or community obstetrics, community ophthalmology, preventive cardiology, preventive oncology, etc. Then there are some allied subjects that is related to health, and these are the determinants of health. So these are health promotion, social sciences, behavioral sciences, occupational health, environmental health, human nutrition, etc. And some non-clinical subspecialties also come under the purview of community medicine. So these are health management, health economics, research methodology, and biostatistics. So in the course, I will discuss all these. Now, a little bit about how to study community medicine. This is actually very difficult to say, difficult to discuss, because each individual has his or her own unique way of studying. So it varies from individual to individual, the way of learning, the pace at which the person proceeds, or the level of understanding also. But still, I will give you a general guideline of what books to follow and how to study, what to do for your exams and for knowing the subject also. So you must be thinking, why is community medicine important? This is a very vast discipline, as I told you, and it does not focus only on one individual who is diseased. The aim is not only to cure that individual of that disease. It is very broad. So what is the vision and aim of community medicine? It is promoting health, preventing disease, and prolonging life. And so it is an amalgamation of public health practice that will promote the health and primary level care of clinical medicine that will prevent the disease or cure the disease, treat the disease, and ultimately it will prolong life. And so how can that be done? By providing comprehensive care for development of holistic health of the entire community. So this is so vast and so broad in its ambit. So with this course and going through your MBBS curriculum, you will be able to deliver comprehensive care. That includes promotive and preventive care, curative care, and rehabilitative and palliative care. So going through this, you will be able to learn by meeting all the educational objectives of all the domains under the Bloom's taxonomy of educational objectives. That is, it will cover cognitive domain, which is concerned with intellectual aspect and development of knowledge. Then also the affective domain, that is concerned with the emotional aspect, and you will develop the attitude. And the psychomotor domain also, that is concerned with the skill aspect, and it builds up the skill to practice. And so at the end of this, you will know the subject, you will be able to feel for the individual and the community, and you will be able to do what needs to be done. So which books to follow? Here again, you can follow any book of your own choice. There are multiple books available in the market. You can read any book that you like, any book that you're comfortable. Basically, what you have to do is, for MBBS Third Professional Part 1 examination, you have to read textbooks. Then you have to read practical modules. There are books available, and also there are practical modules of your own college. So you have to read these very thoroughly. And in addition, you can read question answer books for revision. For competitive examinations, entrance examinations, so you have to read all of these, plus you have to read objective books with multiple choice questions. And for understanding the subject and its application, you have to read all of this. In addition, you have to read publications of the government, of the World Health Organization, and such other premier organizations. And you also have to know the current news, because public health is a daily practice, and there are many aspects of public health which are constantly in the news. Like in the present context of COVID-19, this is such a public health problem. So the problem, the solutions that are being implemented, everything is always there in the news, and you will learn a lot from there also. So some books to follow I have given. You are, as I told you, free to read any book that you want. that you like, which is your choice. But I'll show you some books which are good and you can refer to those. So one is FIAPSM's textbook of community medicine. Another is Park's textbook of preventive and social medicine. These are textbooks for the entire subject. This is a special book on national programs, T.K. Taneja's Health Policies and Programs in India. This is a special book on biostatistics. So Mahajan's methods in biostatistics for medical students and research workers. Then for your preparation for practical examinations, you can read this book, Essentials of Community Medicine Practicals. And having gone through all these, there is this book, Community Medicine Buster, which has solved question answers of previous years of various universities. So this you can look up for your revision of the subject. Now, how to study? So very important is whatever books you read, whatever you do, first and foremost, you have to attend all theory classes, all practical sessions and all family visits regularly and attentively. These are very important. The crux of understanding the subject, knowing the subject, preparing for your exam, this is very important. You have to attend all classes regularly and attentively. And then every day after you come back from the class, in the evening, you read that particular topic that has been taught immediately. That will help you refresh your memory and understand the subject. And another very important thing is that you have to understand the concepts and not only memorize. There are some things which does need memorizing, but then mainly the subject is concept building. You have to understand the concept. You can take class notes that will help you to understand. You can make your own notes for quick revision, whichever way you feel comfortable. And you have to focus on the must know and should know areas first. These are the priority areas. After that, you go to nice to know. So we say there are three areas. That is, at the core, there is the must know area, which every student has to know. It is compulsory. You have to know this must know area. Outside this is this middle circle, which is the should know area. This also you should know. So these are the priority areas which you first have to focus on. And having done that, now you move to the outer circle, which is the nice to know area. So this is the third. You go through this now, you build up your concept and you build up your understanding, and you are ready now to score good marks in your examinations. So revise multiple times, that also helps. You read once, you know it at that time, but you forget. The more number of times you read, the more refreshed your memory is, and the more the subject sinks into your memory and you know it very nicely. So you have to revise multiple times and you have to adjust your timing throughout the course, throughout the session, as the classes, as I've told you, every day you have to read the topics. Now, before the exams, you adjust your time, the available time that you have, and you think up. That is great planning that you have to do. You plan up how many times you will revise, how you will do it. So by the end of that whole study period, you are ready with it. And also attempt solving previous year's question papers and MCQs. That will help you to self-assess yourself, and also it will refresh your memory and understanding. Now to come to the evaluation, that is the examinations. There are two types of examinations. One is certifying examination, the other is competitive examination. So certifying examination means to obtain the certificate, the MBBS certificate. So this examination for community medicine is held at the end of the 7th semester. So this is third professional MBBS part 1 examination. So there you have a theory paper, 2 theory papers you have of 100 marks each, and you have practical of 100 marks. So theory paper has long questions and short notes, and the practical has a grand viva, of course, that goes with theory. Other than that, the practical part has case, that is family with index case. You are given a family with an index case. You have to study the family, you have to study the index case, and then you have to arrive at your clinical social diagnosis. Then there are exercises. You have to work out and solve. Problems will be given, exercises on epidemiology and statistics. You have to work those out and solve. Then there will be spots. So there will be some specimens or slides or pictures, and there will be short questions on that, 1 or 2 short questions. You have to identify the spot and you have to answer those short questions. So this is practical. So this is overall the certifying examination for MBBS that happens. And competitive examination, there will be objective questions and there will be problem-based questions. Problems will be given, clinical problem scenario, and there will be questions asked on those. You have to understand the situation and accordingly decide what to do, etc., and answer the questions that are there. Okay, now I'll tell you about this course, that is this e-learning course on community medicine for undergrads. This is a unique course because this is in the form of audiovisual sessions and that simulate normal classes. So it is very easy to understand, it is interesting, easy to follow, and you can revise also going back. So as you are all aware, now the MBBS curriculum has been revised to the competency-based medical education system, the CBME. And the CBME curriculum for undergraduate medical students was formulated in 2018. And the first academic admission year to be introduced to this new system was the admission year of 2019. And they are due to appear for their third professional part 1 examination in the year 2022-2023, which will include the subject of community medicine. So the CBME curriculum of community medicine, it is spread over 20 topics and that includes total 107 competencies. I'll give you a brief outline of this course. So here the entire syllabus I have divided into 5 sections. And these are the sections. Each section has multiple topics and each topic I have subdivided into subtopics which I have presented as units. So section 1 is on health and its determinants. It has 12 topics that includes 32 units. Section 2 is on epidemiology that has 13 topics, includes 37 units. So section 3 is on care of the vulnerable population. It has 7 topics which includes 19 units. Section 4 is on management in health. This has 6 topics that includes 12 units. So till here, these are the theory sessions. And section 5 is on practical, for preparation of your practical examination. So here also there are 2 topics that includes 5 units. So total there are 40 topics and 105 units spanned over 5 sections. And I'll give you a brief outline of the content of these sections. So section 1 is on health and its determinants. In the first part on health, I have covered the concept of health, concept of disease and concept of health promotion and disease prevention. And along with that, communication for health. And next, the determinants of health. So here I have covered social and behavioral sciences, environment and nutrition. Section 2 is on epidemiology. This is in 2 parts. General epidemiology, where I have covered principles and applications of epidemiology and epidemiological research, including how to conduct the research, how to analyze the data, etc. And the second part is on disease epidemiology. See, here I have covered the common non-communicable and communicable diseases that are of public health importance. And along with the disease epidemiology, clinical features, prevention, control, etc., I have also discussed in detail the relevant national programs. Section 3 is on vulnerable population. So first part is on women and children, which is a very vulnerable section of population of the society. And the other part is on other vulnerable population that includes geriatric group and those into occupational hazards. Section 4 is on management. So here I have discussed health management, international health and healthcare delivery system, its evolution of healthcare in the international scenario, in the national scenario, and thereby the healthcare of the community, how it is delivered. And I have also discussed public health emergency and essential medicines. And section 5 is the practical part. So the first part is on family health, that is how to study a family, how to study an index case in the family. And the next part is on sports and exercises. So here sports based on MCH, nutrition, equipment, etc. and exercises on epidemiology and statistics. But for these exercises, I have given the formula in this section here to sum it up, because the details along with working out with hypothetical examples I have done in the relevant sections on health indicators, on data analysis, where I have detailed the working out. I have even used figures and numbers so that it is easy for you. I have worked it out for you. So here it is summation of all the formula given in gist. So this, going through this will help you prepare for your practical examinations. So now you may be thinking, why DigiNerve? There are so many books. So what is the importance of this? Why is this so good? So here sessions have been planned according to the CBME curriculum of the NMC. Total syllabus has been divided into several sections, each section having some topics, each topic subdivided into subtopics or units for your easy understanding. So you will understand and link the one to the other in the subject. The lectures are also provided with notes and wide content coverage in each session, and the content has been developed consulting several standard textbooks and also government publications, and it gives updated information. Concepts have been explained with flowcharts, diagrams, pictures, figures, etc. Exercises have been worked out with examples. Important areas for questions have been mentioned. Then practical aspects have also been covered. And in the end, there are questions with answer keys for you to assess yourself. And these audiovisual synchronized presentation of sessions, it will hold your interest and you will like it, you will enjoy it, and you will understand in the process also. So advantages of DigiNerve: you can study at leisure. If you want to take a break, you can pause it and then again resume it. If you can go back a few slides before to see what was there. You can revise multiple times, as many times as you want. And this helps to prepare for your theory as well as practical examination for MBBS Third Professional Part 1, as I told you, and also for your competitive examinations. And overall, this helps to clear your concepts and qualify all examinations, as well as understanding the subject in detail and in depth. So this picture sums up the discipline of community medicine. So here you can see it is a picture of the community. You can see the community, the place, you can see the fields, the trees, the birds, the sky, and you can see one health center in the middle of the community. You can see a couple going towards the health center to seek treatment. In front, you can see this lady in blue. She's a community level health worker. She's talking to a group of people. So she's giving health education messages. This is a health education session going on. She is giving health messages to generate awareness among them regarding the health problems, regarding the solution of these problems, and how they can take care of themselves. So this is what exactly is done in the community. And so this message, it sums it up all. This is the crux of the discipline. That is, we enable them, empower them to take responsibility of their own health. So with this, I end this orientation session, and subsequently I will be starting with all the units and topics that I have explained to you. So I'm sure you will enjoy this course thoroughly, and I'm also sure that you do very well in all your examinations, come out with flying colors. And also I hope some of you will take so much interest and liking for this subject that you will be wanting to pursue community medicine in your specialization for your post-graduation, and you will become excellent public health professionals, and it will make a lot of difference to the health status of the community and of the entire country. So best wishes for happy learning with DigiNerve. Thank you.